Delivering the highest level of functional care for the injured worker at home is the shared goal of the Paradigm and BAYADAbility partnership. Our team's commitment to excellence, customized care, and working together to achieve the best client outcomes is what draws us together and sets us apart.
Joseph had a high-level spinal cord injury, which resulted in respiratory ventilator-dependent respiratory status.
I went to work on June 29, 2016, and as I was passing by one of my coworker doing a work, so I decided, let me go help him. So while I was helping him, and there's a bag that go up, and the bag fall on my neck. I was out after that.
Paradigm is an injury management company. Joseph fell into our catastrophic injury management product. We do very specific catastrophic injury management work to take a patient from the date of loss through the continuum of care, transition them home if possible, and into the community within the limitations of their disability or their injury. And then Paradigm is responsible for all facets of that case. This gentleman is ventilator dependent. What kind of backup equipment do we have? What kind of equipment needs what type of access? So we needed Bayada to really be part of that and helped right down to the design of Joe's new apartment.
He was unable to come to his primary home while renovations were going on for a number of reasons. But prior to going to the apartment, Bayada was able to bring a whole team of nurses in to Kessler for that transition piece. So by the time they got him home, they already knew Joe, and Joe knew them, which was very beneficial because we're now home a year and a half, and he still has the same staff.
While that was happening concurrently, your team was in the house teaching, training family members to provide the necessary support. It takes a village. Paradigm and Bayada are part of that village. It's not simply contacting a vendor to provide a service. It's something a lot more intricate and a lot more special.
Over the time, we worked a lot with functional stimulation, aggressive outpatient therapy. We really were able to start seeing some significant arm movement coming back, especially in the right arm, where he was actually able to hold utensils at certain points, pick up blocks, raise his arm like a little bit. Joe has almost the world basically like at his fingertips, so kind of continuing to look at technology and seeing what we have out there. I think we're really looking for Joe, now he's in our aftercare program, to continue where his strength is and hope to continue building upon it, and really look that he could get a little bit more independent in feeding himself most of his meals, maybe even brushing his teeth down the line.
Right now, I wish I could, eat by myself, or get up and at least take a couple steps without nobody helping me, but I guess it's not time yet, so I'm still waiting.
I want nothing more than to have one of my catastrophically injured patients' clients be the best that they can be at the end of the day. That's what we're here for.
I think what was most impressive about working with Bayada was working with them out of the gate and their ability to be part of the clinical planning even before they were in the home. It's a home care company, so to have them be part of what we were doing so that they were always stepping with us and not a step behind was pretty significant.
It's been a very remarkable relationship. I can say from my end, I'm very happy that we moved forward with this pilot and with this collaboration. I definitely am hoping that it's here to stay.
This collaboration is going to be what healthcare is going to need to draw people together, since our hospital systems are enormous.
Length of stays in hospitals are becoming shorter and shorter, so the need for home care is going to become greater and greater. Together, we gave it that human touch. We were able to maintain the human touch. We have to really say the star of this whole show is Joe, because he's motivated. He wanted the best that he could get for himself, and although he had so many things to face, he never lost hope. He always had a smile on his face. I really believe that played a big part in why this case has been so successful. He's an incredible human being.
Partnerships that leverage the best of each other's expertise in a collaborative, proactive, and client-centered approach are advancing the future of home healthcare delivery. Together, Paradigm and Bayada are not only helping to advance that future, we're leading the way.